All right. Good evening, everyone. You're officially welcome to today's Safeoclock Health and Safety Interactive Workshop. Today is 29th of February, 2024. And we have beautiful and handsome people in the house. And as the custom is, we start with a brief presentation. After that, we go into individual discussions where we share our experience and we ask questions also and answer each other. So today, Mr. Stephen will lead the discussion. He will start his presentation, then followed by others. So I'll give the room to Mr. Stephen to start.
Okay, give me access.
Okay, you can share your screen now.
Okay, good evening once again, everybody. Yes, as we all know, the topic for today's discussion is we're talking about fatigue management. Okay, and the truth is, for us to understand, for us to get the idea or how to manage fatigue, we need to understand what is fatigue. So by definition, it is a state of mental and or physical exhaustion which reduces a person's ability to perform work safely and effectively. So because when we look at it in the perspective of health and safety, where we are coming from, so it needs to be well defined this way. And fatigue is the result of not setting or not getting enough sleep. Okay, in some cases, managing fatigue is one of the components, of approach to employee well-being. Because when you look at a lot of organizations today, you're talking about health, safety, and well-being. So for the well-being, you're talking about mental health issue, you're talking about stress management, we're talking about, and all these things they interrelate. They have this interrelationship between each other. Now, I just want to let us understand most of those signs, that can be presented, that will make us understand this person is experiencing fatigue, and fatigue could come in the form of physical, mental, and emotional dimension. Okay, so sometimes when you discover that when somebody is finding it difficult, to sleep, this could be a sign of fatigue, but not in all cases, okay? So some could just be medical issues, but in some cases, when you have this sleeplessness, it could be a sign of fatigue, okay? So, and also tiredness, irritability, depression, giddiness, loss of appetite, digestive problem, and increased susceptibility to illness. You see, all these things are what we know, either by definition or by little understanding. You see, sometimes when you are fatigued, especially when it comes to digestive problem, you see some people having this, you can come up with even constipation, you can come up with so many things that can really affect your mental state or mind. Now, to go further, we'll look at what are the factors or causes of fatigue. There are so many things, when we take the workplace as an example, okay, because we're all speaking as a professional here and putting it in the perspective of the workplace setting. Okay, so, that is why globally, apart from Qatar, globally, International Labour Organization and all that, there's a set standard of hours people should work. In fact, maximally, you cannot work more than 12 hours anywhere in the world, as in that is like the standard. But you see the minimum is within 8 hours. So in some organization, you see 8 hours to 9 hours, 10 hours, especially when you go to hospitality, you now see it going towards probably 12 hours, but it should not exceed 12 hours. So in any country, any jurisdiction, when you look at it within their local and international law or regulation, it does not exceed this particular hours. So definitely long hour, when you work more than the normal required hours, this will predispose you to fatigue. Okay. Now, another factor again is when you eat very late before going to bed, and also eat heavy food, you are likely to wake up, and not perform very well at work. That might also lead to a kind of little bit fatigue because you went to bed with heavy food. Okay, so now there are some other physical activity that generate vibration, like using a damper and all those things that, or some other kind of, yeah, using this, those people who what do they do? These people that they cut this slab, concrete and all that, So in fact, any kind of physical activity that require you using an equipment that generates vibration, and when your body absorb a lot of vibration during such physical activity, this will also predispose such workers um, into fatigue. And also activity that generate noise. Some vibrated activity also generate noise. Some kind of processes, generate noise within the workplace. So when workers are exposed to all this kind of physical activity, they tend up to build in fatigue within such kind of, because most of us might have experienced this thing, because it's just that there's nothing new or strange here. You could just imagine yourself going through somewhere that, in fact, the place is generating a lot of noise. You just discover that you will not even understand how you feel. At that point, you just discover that you are under fatigue. So those are the signs. Those are the factors that could lead to fatigue. And also some mental activity. There are a lot of things we do, even in the workplace, that trigger our mental health, so it could come from different dimensions. It could lead to emotional issues. So all these are factors that could make you, go down completely. And we'll begin to see later in the next slide how this fatigue will affect performance, productivity, and all that, and how it could also lead to some serious injury or fatality in the site, and also some kind of ergonomic setting. We've discussed this topic about ergonomic before. So, if you don't have a good ergonomic setting, especially those who work in the office or those who work in other part of the company whereby there is no proper way of you doing your job, this could lead to serious fatigue. And somebody who is fatigued, we could all know how such kind of person can be productive on site, and how that person is also predisposed, to risk or accidents. So these things are very, very important. And also, when the area of travel, I just want to emphasize, like, sometimes when some workers resume, like for me, even if I'm going on vacation, I like to come at least 1 or 2 days before I will resume work. Because some people, the day they land, maybe in the morning, maybe like 5 a.m., they are going to work that same day. Sometimes all these things are not good, because even you travel for almost 6-8 hours on flight, and maybe you'll be fatigued. It's the normal thing. How can you just be on flight? You just be in one position like this for several hours. You are likely to experience fatigue, and also resuming work immediately is not the best practice. You need to have some days for your system to acclimatize and recuperate from the stressful journey and all that. So also night shift. When you work at night, you discover that people who work during the day are far better than those who do night work, because when you work at night, you discover that there's some activity you want to do or catch up during the day. So you'll not be able to have enough sufficient sleep during the day. So you find out that as a result of you not having enough sleep, like I've mentioned earlier, when you have this sleeplessness, you don't have enough sleep, this will also lead to fatigue, because you'll be stressed and all that. So insufficient break time between shifts, you are working maybe morning shift or night shift, and you don't have enough break in between. Like there was a site I worked one time like that, a construction site. So I remember that in the morning, once it's 8:30, you have a 30-minute break till 9 a.m. Then everybody go back to site till maybe 12 to 1 again for another break. So it all depends. So sometimes it is good for people to have sufficient break, enough time to rest. If you don't have inadequate time to rest in between, you discover that all those things can bring in fatigue into the system. And, the fatigue itself is an hazard. It could lead to a lot of things. It could lead to a lot of things, which we're going to see later. Also, excessive stress, and also heat stress, any form of stress, that can happen within the work site could lead to this same fatigue we are talking about. Also, workers who are exposed or expose themselves to substances abuse within the site. We know what happened, especially some people, you see them on site, they take some stuff, some people, they smoke. That is why you see, they say, I'm tense, they go and smoke. No, you are even creating more problem because you are creating more fatigue to yourself. You go to site, you have to take, you take alcohol, you take some other kind of substances, and also people who take this coffee, anything that contains caffeine and all that. It is not good because it will not allow you to sleep. In fact, as a matter of fact, like for me, a tea bag of Lipton or a bottle, maybe 35 cl of Coca-Cola or Pepsi, because those things contain caffeine. If I take it, I will not sleep the whole night. That is for me. This, I knew it even when I was an undergraduate. Okay, so because for me, I'm a kind of person that I like studying at night, not during the day. I get distracted more during the day. So I value my night so much. So that was where I was able to discover that little caffeine for me, it can keep me awake for the whole night. In fact, I'll be begging for sleep. So those things are very serious issues. Anything that you do, that you take that will hinder or have an impact on your sleeping pattern and all that, they can lead such individual to fatigue. So I think, okay, this ergonomic, I repeated it twice here. So, and I've said much about sleep. And some of these factors they could combine. It might not necessarily be one. They might have a combination of many of these factors leading to fatigue within the body. And sometimes a sleep disorder, this now we are going medically, a sleep disorder may cause fatigue, because the truth is that once you do not sleep, you will definitely have fatigue. So in a case where you have a sleeping disorder, this could also be predisposing such worker. That is why sometimes it is good for an organization to expose their worker to do some kind of medical examinations and all that, at least to understand. That's why when you go to some area like the oil and gas process industry, place that is highly hazardous like that, you see they don't take all those medical issues. In fact, you do medical. I believe those who work in Aslafan, you do medical when you want to get to job there, you do medicals and all that. So all these things, they check them, so that they'll be able to understand that this person is fit physically, mentally, health-wise, need to be able to perform, so that you don't just go to site and start pushing yourself. You will take yourself into the hazard. In fact, you will be the one to intentionally cause an accident because you are under fatigue. So these are the reasoning, because it's fatality. We know how implicated it is, because a very big and multinational company will want to prevent their name, so, and they will not want the public, this perception from the public to be a very bad one. So when we look at insomnia from the medical perspective, it's a condition that people have this difficulty, going to sleep. So such can be handled medically. And also we have what we call the sleep apnea. In this situation, there's a kind of obstructive sleep apnea, whereby somebody sleeps within some few seconds. The throat and the respiratory system, they will just, will I say, collapse within just few seconds, but not on the long term, So within those periods, it's discovered that the person will not have sufficient breathe. So during the day, this person might undergo fatigue as a result of that as well. So there's what we call restless leg syndrome and narcolepsy. We will not want to go that much further because it has to do with more of a medical perspective. So now let's look at the effects of fatigue and its relationship to work. Okay, now for somebody who is fatigued, absolutely you discover that you have a reduced decision-making ability, which means you will not function properly at work. It also reduces the ability to do complex planning. Okay, if you have to plan the job, it's going to affect you. Okay, and it also reduces communication skills. You won't be able to communicate properly, within the working environment. this also will reduce productivity and performance. So all these things are very important, because if we don't manage fatigue properly, these are the implications it will have at the end at the end of the company side. So these are the areas we need to continue to preach, at the level of the management, to make them understand, because sometimes these people don't have this knowledge. We need to tell them this thing work pari passu. You stress people, they enter fatigue, you have less productivity, less performance. So these are the things we need to use for an argument with them. So this also reduces an attention and vigilance. So you discover that you will not be having attention in the site. You will not be so vigilant to identify risk, to see risk coming, or to see danger coming. So at the end of the day, you discover that such an individual is prone to an accident on the site. And also another effect is that it reduces the ability to handle stress on the job. Sometimes, like when we discussed stress some time ago, we discovered that at some level of stress, you need some certain amount of stress, to perform maximally. Okay, so there's always this relationship. In as much as I would say stress is not good, sometimes you need it to a certain amount or a certain degree. It is when it goes beyond that level that it is not good otherwise. So there are some situations whereby we need the stress to handle some certain jobs. So when you have a reduced ability to handle it, then there's a problem. So also we talk about reduced reaction time, both in speed and thought. It's simple and plain English. So when you are exposed to this fatigue, you cannot react to you have this failure to react to things that require speed and maybe a thoughtful reaction. So all those things will impede those processes. And also we have what we call loss of memory or ability to recall details. So when people are fatigued like that, they tend to have this reduced or complete loss of memory at that particular time. And also failure to respond to changes in the surrounding environment or information provided. So somebody who is fatigued, you are giving him 2 bus stops, you are giving him induction. It's a waste of time. You understand? So these are the implications. Okay, and maybe you are doing the normal weekly 2 bus talk, and those people are stressed and all that. So these things will not get in, to the workers, and also unable to stay awake. That is falling asleep while operating machinery or driving a vehicle. We could see the implication of that also. And also we have an increased tendency for risk taking. Somebody who is fatigued, the way he will reason is different from somebody who is normal, because the person will want to take risk. He will be so much confident that nothing will happen. Let me take it. So, and also we have increased forgetfulness. You tend to just like memory, you forget a lot of things. Increased error in judgment. The person is likely to have a lot of error in judging some issues, some things within his brain and all that. So this could affect a lot of things in the site, just for the purpose of time. So we don't want to go deep into all those things. This is a very complex topic that if you want to break everything one after the other, you need to go deep. It also increased sick time, absenteeism, increased rate of turnover. So we could see the implication to an organization. When somebody is sick, you have a lot of sickness within the site. This is affecting the productivity or the production of such company. When people are sick as a result of fatigue, their absence from work, we know what that could cause to an organization. This also leads to high rate of turnover within the organization, and also increase medical costs, because when you go to hospital, you go to clinic and all that, it tends to, and to an extent, it might increase a kind of insurance premium as well. And also, this can also increase accident rate, like I've said. When you decide to take risk, you decide to just go in for it, you discover that might lead to accident, and that might increase the rate of accident within any project site. So now, we'll just look at the principles of fatigue management. In this principle is guided by, we'll say maybe principle or policy of fatigue management. Now, fatigue management should be as a form of advice or a guidance rather, it should be incorporated into normal management function of any business organization. And this we include what we call employee must be in a fit state to undertake work. That is why the example I give in the first place, you go to the oil and gas. In fact, even the worst country in the world, they will not compromise. Even the country that will say they don't have safety. But when it comes to the oil and gas, because these are very sensitive industry, they are very sensitive industry. There are a lot of explosives. There are a lot of things that will make that place explode, that can cause fire and everything. So there they don't, even in Qatar, if the sheikh is going to, he will wear helmet and wear everything. He will kit up before you go to site. So that's how it is. It's not about your position. It's not about what you have in the society. It's all about understanding the environment, complying to safety. So this is a must that companies should encourage it. And second point is employee must be fit to complete a particular task or work that he or she is given. So all these things are very, very important. This should be incorporated into, if you're designing a policy, you need to make all these statements in there so that people will be able to understand properly. An employee must take a minimum period of rest to safely perform their work. If you feel this is not important, why during the time of summer, when you look at your stress management plan and all that, you see there's always a provision for all these things. If you feel they are not important, then let us not do it and let's see the implication. So I will leave us by that with that. So when we now look at the principle of fatigue management also, now this principle should be able to go through an appropriate planning of work tasks, including, like, for example, maybe for those who are driving, those drivers, look at driver, they look at equipment maintenance, loading and unloading, and other job-related duties. I just try to mention a few. So there are other form of tasks, job activity that, you need to give a kind of appropriate planning towards that particular job or task that you're going to do. And also providing appropriate equipment to help reduce stress and fatigue in the sense that in some cases where people have to do some things manually, definitely it will lead to fatigue, right? So if you are able to provide an equipment to lift such material and all that, that will reduce it. You just imagine people lifting materials up and down, things like that. Within an hour, the person will be stressed, the person will be fatigued. But if you have an equipment, you discover that you reduce such workers from such. So we have also our regular medical checkup and monitoring of health issues are required by legislation. We all know this. And we should also keep encouraging and advocating in any organization we find ourselves to make sure that all these things are implemented. And also there's what called provision of appropriate sleeping accommodation where required. Like when we look at some organizations, they have provisions for accommodation and they have normal inspection for all these facilities. So it's not about just tucking people in, how accommodating it is for them to sleep, not just junking people together and expect them to have a good sleep. So if you don't have that, at the end of the day, the next day the workers come to work, you discover that they will be fatigued. So people designing, people brought up the idea that accommodation should be inspected. They should have a standard. They were not fools because all these things were put into consideration. And ongoing training and awareness of employee health and fatigue issues will also be included within such management, maybe fatigue management plan within an organization or procedure, whichever way is being done within such an organization. So now, properly, when you look at the first step, when you try to manage fatigue, we need to look at, we should be able to manage it based on the hazard that it poses, So we need to also understand this hazard, that it brings within the site. So the best way to control fatigue, is to eliminate the factor or what causes it, okay? We need to identify it. Once we identify it, we need to eliminate it. With the elimination, we have managed fatigue. It's very simple, right? I'll make an example. Somebody is doing some job manually, which can predispose such individual to fatigue. How can you eliminate it? You just eliminate it completely from somebody doing that job manually. You can introduce an equipment that can do that. So there are many scenarios, there are many situations, but I'm just trying to bring that as a kind of example. Another one is we have to substitute, like maybe substituting a safer practice, such as increasing the length of break in a shift. That's another good example, so to be able to balance up, so that workers don't get exposed to the fatigue. Now, in engineering control, we can control engineering and through engineering control, in a situation whereby maybe such kind of activity require maybe ventilation or eating to improve alertness. So, in some situation, there are some working condition you find yourself that if it is not well ventilated, somebody becomes stressed. From stress, it leads to fatigue. So like I said, all those things, they have interrelationship. From not having enough sufficient ventilation, you imagine your brain everywhere, your system will just automatically switch into fatigue and predispose such individual to so many things in the side. And it is very important that in such cases we provide some kind of engineering control in such situation to ensure that there's much ventilation. It could come in the area of lighting also within the site, but I don't want to start putting all those details so that we don't have too lengthy slide. Now, we also have a procedure and training program. We should be able to introduce series of procedure. We need to introduce a lot of training program to critically support this effective control of fatigue within the site. Okay, now we need to set a work hour limitation and job rotation schedule. Just like that's why I make an example of what is applicable during summer, because of heat stress. You see, the working hour will reduce, the exposure time will reduce, a lot of things will reduce, a lot of things. So in order to make such worker, because when you undergo heat stress, you are fatigued. That is the truth. So like I mentioned in one of the slides earlier. So also the use of gloves for vibration work or better hearing protection over 8 hours work period can reduce fatigue. Like I've said, I mentioned earlier, we know some physical activity within the site that can lead to vibration, can generate noise. So one of those things, like about PPE, we have to consider those things in order to reduce fatigue. We need to introduce job rotation to reduce fatigue. So those things are very, very essential to be able to manage fatigue on our respective sites. Now, irrespective of that, a lot of people have responsibility. We all know the number one people or the number one person that have responsibility is the management. The management must accept responsibility for the implementation of fatigue management policies and procedure within such an organization. Now, the site line manager or supervisor responsible for implementation and maintenance of the policy or any program that is set aside or procedure on site to ensure that everybody is in compliance with the program, not that they will be waiting for safety to come and be shouting before they know that something like that exists. So for employee must be present in a fit state, free from alcohol and drug. Employee must not chronically use over-the-counter prescription drugs to increase mental alertness, because if you see some in the site, it's common here in the Middle East. I don't know what they used to do in their hand like this. They will put it sometimes. What is this? They say you give energy, and so all those things are they are not good, because they can the aftermath effect is what most of these people don't understand. You might get that alertness at that time, but the later effect will lead to fatigue. So another key responsibility to employees is that because they have a lot of responsibility, they are prohibited from taking any substances known to increase fatigue in that fatigue as an employee, and also include fatigue that sets in after the effect of the drugs. Just like I've explained, some drugs you take it, you might have energy, you might have a lot of things, but what's the aftermath? It's always a problem. Now, workers shall report tiredness, fatigue to supervisor. Okay, it's very, very important. When you're undergoing fatigue or stress, it needs to be reported so that they can take appropriate precautions so that you don't get exposed to accidents. So an employee also must report fatigue, tiredness, and lack of mental equity to supervisor as well, and also to prevent loss. Employee need to be rested prior to starting work. You know, sometimes you just need a little bit of time to relax before the day activity. You could see that happening in some construction sites when they resume duty by 6 o'clock. Sometimes you see some people just hanging around, relaxing, spending some time before they start their main job or task activity. So employees need to monitor their own performance and take regular period of rest to avoid continuous work when tired. We see this a lot in the construction site. They don't need to tell us. We see sometimes their foreman will go and start shouting at them while you're sitting down and all that. So sometimes they don't know they don't know why those people are taking rest because they know they are within themselves. They know that they're a little bit fatigued, so they just need some time to rest. So sometimes these are the things we see on site. And I will end by saying thank you very much for giving me the opportunity. Though we've spent a lot of time, but at the same time, the time is not wasted because we've learned a lot of things. I'll hand in the baton back to Mr. Johnson to open the floor for other people to make some contribution. Thank you very much.
All right. Thank you very much, Mr. Stephen. That was a very, very detailed presentation. You have done justice to the topic. And like I always say, the information we learn here is not just for our own use, it's for us to propagate the gospel so that when we learn or when we refresh our memory, we should take that same energy or that motivation to teach our colleagues and our workers about this topic, because some people pass through fatigue and they don't know that it's fatigue and they don't know what to do or what they are supposed to do to get out of it. So Mr. Stephen has said a lot. I just want to present just one slide. I will not go through all my slides. Just talk about this slide and others can contribute. Now, he has said most things about fatigue. Now, the few things I want to add is, when is it the right time to take fatigue serious? Because in some situations, you find out that you think that the fatigue will just go away, or you think that after some time, everything will get better. But there are some, in some situations that we should consider very, very high risk. So if, for instance, the fatigue has gotten to a point that you cannot be able to account for what is the cause, you have checked yourself, maybe you sleep very well, you sleep on more than 8 hours, and you are not doing enough work, you're not doing such a heavy task, and you have checked around you, but you cannot be able to point out what exactly is causing your fatigue. So at that situation, you should make out time to visit your doctor. The second one is if you find out that your temperature becomes higher than your normal body temperature, and this is a repeated occurrence. It's not just that it happened maybe because you were exposed to high temperature, maybe the sun, but it becomes a regular occurrence. So at that time, you need to pay a visit to your doctor. The next one is if in a situation whereby you started experiencing weight loss and you cannot explain why you are passing through this situation. You are not facing stress, you are eating very well, and you think you are healthy. But in as much as that, you are still losing weight constantly. So at that time, you should be paying a visit to your doctor. Or in a situation whereby you find it so difficult to fall asleep, or you find it difficult to stay asleep. Maybe when you sleep, just in the next 2 minutes, you are awake. The next minute, you are sleeping. The next minute, you are awake. So at that time, something is medically wrong that you need to visit your doctor for. Or in a situation whereby you think you are depressed, you think that the cause of your fatigue is depression, so you should not take it lightly or try to treat it yourself. You should be paying a visit to your doctor. Or in a situation whereby you start vomiting blood in addition to your fatigue. If the fatigue has come in combination with other serious ailments, then you should not manage it yourself. You should pay visit to your doctor. Okay. So if you, instead of not just feeling weak or tired, you are feeling faintness, you feel like you want to faint, at that time you should be paying a visit to your doctor. So I just wanted to add this in addition to all that Mr. Stephen has said, that fatigue we should not take it lightly, and we should also encourage our team or our workers to take also fatigue seriously. So when it start getting out of hand, when the cause is unknown, and when you can no longer bear it, you should not keep quiet. You should visit the doctor for proper examination and for proper treatment. So there are few lifestyle changes that can help improve fatigue situations. The first of it is to drink enough fluid. Drinking enough fluid and staying hydrated all day round can help to improve the fatigue situation. Practicing healthy eating habits. Healthy eating habits could be eating at the right time and eating the right proportion and eating healthy food, or going through regular exercise, engaging in regular exercise and being fit and keeping fit could help to improve a fatigue situation. Then getting enough sleep, Mr. Stephen has said about this. Getting enough sleep can help to improve fatigue situation. Then avoiding stressors, those things that triggers the stress, avoiding them and doing away with them will also help to improve the fatigue situation. Then abstaining from alcohol, tobacco, and other illicit drugs can also help and relieve those fatigue situations or symptoms. So this is the few lines I wanted to add. And thank you, Mr. Stephen, for elaborating on the other points. So our time is fast spent, but I would, few people will still have to contribute. Just make it short so that we can close on time. Yeah, anyone that wants to contribute, go ahead.
Okay, good evening, everyone. I think this is a very good topic, and one that each and every one of us from time to time have experienced before. One thing I will just add, like a just bullet point, is that fatigue also makes us to be easily irritated. You know, our stressor level is high already. So things on normal day that will accommodate, things that we will not easily react to. When we are fatigued, we just easily respond. And as supervisors, as superintendents, as managers who have who people bring issues to, this may be a red flag. So it's very important that all the points that control measures that Mr. Stephen has informed us that we abide by them. Very important. Thank you.
Thank you very much, Mr. Femi, for that wonderful straight-to-point contribution. That is very, 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 very well noted. Thank you. Okay, the floor is open. We can take one or two persons more. All right, if there's no one available to talk now, so we can end the session so that we'll not keep elongating it.
Please, sorry.
Okay,
I want
go ahead.
Yeah, I was supposed to raise my hand before I make any comment. Sorry, I've not been consistent on the meeting because of one or two reasons. I want to say thank you all for all your continuous endeavors and your time. Just want to let you know that I'll be trying my best, announce my presence. I'm sorry for not attending all this while because of one or two situations. Thank you so much for everything, everybody. Mr. Stephen, Mr. Femi, everybody that's in the house, thank you so much. I want to recognize your effort and everything. Thank you.
Thank you also for attending. It's not easy.
Thank you also, Ifeanyi.
Mr. Sunday, thank you so much.
Yeah. Thank you, sir. Thank you. Thank you so much.
Okay, guys, thank you very much for attending today's session. Before the official session, we had other session that we encouraged ourselves. So let's hit the next week with this motivation and keep improving. Inshallah, everything will get better than it is now. So thank you guys for joining today. And next week, Thursday, we'll treat another interesting topic.
Thank you, sir.
All right. Thank you, Femi. Thank you, Stephen. Thank you, Ismail. Andrew, thank you for joining. And do have a lovely weekend.
You too.